Morning. How my people doing? This is Mr. B. Welcome to the Shades of Clarity channel. Today's April 5th. It's a Friday, and I got something I want to talk about today, especially for people that are in recovery. What are PAWS? Well, you may have heard the term. It's an acronym for Post-acute Withdrawal Syndrome. And it usually occurs, it's sort of a subset of symptoms once you have completed the acute phase of withdrawal of whatever drug you may have been using, whether it's alcohol, cocaine, methamphetamine, heroin, fentanyl, anything like that, Xanax, Ativan, diazepam, Valium. And even some medications used for depression, like the SSRIs, the Paxils, the Prozacs, the SNRIs, things like Effexor. They don't usually use the term post-acute withdrawal. For those situations, it's called discontinuation syndrome. What the hell, it's the same thing. Where you can be irritable, have feelings of sort of a rebound effect. These symptoms can vary in different ways. Like I mentioned, they can mirror slightly a different intensity of what you may have felt, especially with benzodiazepines, which have about the longest withdrawal, post-acute withdrawal of any drug there is. I mean, the normal timeline for benzodiazepines, something like Valium, it does have a long half-life and does have active metabolites. You're looking at acute phase of about 2 weeks, and then the acute, post-acute withdrawal can last up to, I don't know, some reports have been beyond a year. Some people say they didn't feel well after 5 years. I mean, it just depends on your body's chemistry and just your body's ability to bounce back, because what happens is, like alcohol, it's a depressant. It affects the central nervous system, specifically GABA, which is GABA-aminobutyric acid, which is one of the inhibitory neurotransmitters in the body. You have excitatory transmitters, things like norepinephrine and cortisol, actually adrenaline too, that are there for a reason. If you feel frightened or you need to get yourself out of a situation, the fight or flight, GABA sort of adds an equilibrium between the two neurotransmitters. It's sort of a natural sedating neurotransmitter that will bring the body to that homeostasis, so you're not too calm and you're not too anxious and worried and cranked up, because that's what those the excitatory neurotransmitters do. In the case of the benzos, you have a down regulation. Basically, if you're using the benzos, then your body figures, hey, why should I produce more GABA? You know, and in essence, the body becomes lazy, and it causes a what's called a down regulation. And once you have that down regulation of your GABA, now you have up regulation of the excitatory transmitters, like norepinephrine and cortisol, and your body becomes flooded with that. So during a cold turkey withdrawal of benzos, which is never ever recommended, slow tapers only. Again, I'm not a doctor. Please don't take this as medical advice. It's strictly for educational purposes. I'm not a licensed physician or a nurse or anything like that. If you're having any kind of problem, please contact your own primary care person to talk about this stuff if you're deciding you want to come off of it to avoid any kind of problems. But if there was a cold turkey situation with the GABA, like the alcohol, it's the same thing, a GABA down regulation. Then once the drug is removed, now you've got this overabundance of excitatory neurotransmitters. That's the withdrawal syndrome. That's where you get the vomiting, that's where you get the sleeplessness, that's where you get, you know, all the unpleasant symptoms associated with things like alcohol withdrawal and benzodiazepine withdrawal. Opioid withdrawal is similar in that the opioid receptors become downregulated due to the presence of a opiate or opioid in the system. So then you'll get, it seems like all drugs aside from cocaine that has a psychological withdrawal. Methamphetamine can have like a psychological withdrawal, but it's not like it varies, and it's not in treatment centers they don't really give you any sort of thing like they would give you benzodiazepines for alcohol withdrawal, or they give you phenobarbital for benzo withdrawal. They can't really do anything for what I've seen for cocaine withdrawal. But it seems like most drugs have a built-in penalty. It's like if you're gonna play, you're gonna pay. Marijuana is one of those drugs that's very strange, that it doesn't, I've known people that have been psychologically sort of dependent on it, where man, I gotta have it, you know, because it treats, they use it for anxiety. But as far as a withdrawal syndrome, no. But the PAWS mainly is the benzos are probably the worst for post-acute withdrawal syndrome. Studies have shown that dopamine disruption is typically cause of PAWS. Also with the benzos. Benzodiazepine-induced brain injury. Some of those symptoms you'll find when PAWS does occur. You can have depression, impaired interpersonal skills, obsessive compulsive behavior, feelings of guilt, autonomic disturbances, pessimistic thoughts, impaired attention control, lack of initiative, craving, inability to think clearly, memory problems, emotional overreactions or numbness, sleep disturbances, extreme fatigue, physical coordination problems, stress sensitivity, increased sensitivity to pain, panic disorder, psychosis. That usually kind of happens with if you were to withdraw off a Xanax really fast. Cold turkey sometimes can happen. Generalized anxiety disorder, sleep disturbance, dreams of using behaviors associated with the lifestyle, and mourning the change in lifestyle, meaning you're kind of sad to see it go, even though that it's probably in your best interest. You know, if you want to stay, keep your body lean and your mind clean, as Henry Rollins once said. But that's kind of some of the treatments for post-acute withdrawal. Flumazenil they use for benzodiazepine post-acute withdrawal. Alcohol, acamprosate, and naltrexone. Now, I had a naltrexone shot once, which is the withdrawal shot. Very expensive, almost $1,000 a shot without insurance. And what it does is it acts kind of like naloxone does in Suboxone. It blocks the effect of the alcohol. And so in order for you to become intoxicated, you would have to drink a ton of it. I've heard people say that it works. I've heard people say that it doesn't work. I don't know whether it did or not. I know the shot that I took, they messed up the shot, so I had this bump. It felt like a little mushy marble, like on my hip, and it was there for probably 3 months. But I didn't drink that whole period, so I can't tell you whether or not it worked or not. I've taken the oral naltrexone, and I wasn't drinking then either, so I can't report on the efficacy of the medications. I've heard that it does wonders for people as far as cravings go, and the cravings are another byproduct of PAWS, the post-acute withdrawal syndrome. But as always, you know, I really want to see everybody do well, Take it easy. I'll see you later.